SwayamPrabha. Digital India. Educated India.
Hello, I am Dr. Pallavi Bajpai from Dr. D.Y. Patil Medical College, Pimpri, Pune. The topic for today is axilla and axillary artery. What is axilla? Before we start learning about the axilla, I would like you to appreciate two conditions. In the first picture, we can see a swelling in the region of the axilla. It is an axillary abscess. In the second picture, we can see a red line marked in the axilla, that is the axillary pulse. We will be learning about these conditions today. My lecture will be covered in two parts. First, I will be talking about the axilla and then about the axillary artery. The axilla I will cover under introductions, boundaries, a word about the clavipectoral fascia, and finally the contents of axilla. The axillary artery, I will talk about origin, course, parts, relations, branches, then the scapular anastomosis, and finally the clinical anatomy. So now we start with axilla. What is the axilla? The axilla is a space between the upper part of the arm and the side of the chest. It's a gateway for important nerves, vessels, lymph vessels to reach through from the root of the neck to the upper limb and vice versa. Its shape, what is the shape? It is like an irregular pyramid. As you can see in the picture, this green colored area, this is the axilla. It is there between the arm and the side of the chest. And important structures you can see coming down into the axilla from the region of the neck. Before we learn about it, we should also know that there is a skin fold in front of the axilla, which is called as the anterior axillary fold. It is formed by the lower border of pectoralis major muscle, and posteriorly there is a skin fold called as the posterior axillary fold, which is formed by the latissimus dorsi medially and the teres major muscle laterally. What are the boundaries of axilla? The axilla has an apex or an inlet. So, this is the apex or the inlet. It has a base or a floor. This is the base or floor. It has a medial wall. This is the medial wall. It has a lateral wall. This is the lateral wall. It has an anterior wall which we can see in the front, and a posterior wall marked by the dotted arrow, which we cannot appreciate very well here. What we can appreciate is that a blood vessel coming through the axilla and passing into the arm. So, first let us talk about the apex. The apex lies in a horizontal plane. It is triangular in shape with the apex pointing laterally. The upper end of the axilla is directed towards the root of the neck upwards and medially. Then what are the boundaries of this apex? Anteriorly it is formed by the clavicle, posteriorly by the upper border of the scapula, and medially it is formed by the outer border of the first rib. There are important structures which pass through the apex into the axilla, and they cross over the lateral border of the first rib. What are these structures? They are the axillary vessels, that is axillary artery and axillary vein. Then cords of brachial plexus. These structures are enclosed within a sheath called as the axillary sheath. Also passing down is the long thoracic nerve and efferent lymphatics that ultimately go up to form subclavian trunk. The base. What is the base formed by? It is formed by skin, superficial fascia and axillary fascia. So, if we look at the second diagram, the lower part, This is the anterior wall of the axilla, this is the posterior wall of the axilla, and this curved area, this is the base. So, from outside it is formed by the skin stretching between the anterior wall and the posterior wall. Then slightly inside or deeper it is a superficial fascia, and deepest is the axillary fascia. This axillary fascia is supported by a special fascia called as the clavipectoral fascia. Then we have the anterior wall. The anterior wall is formed above by the clavicle, then by the muscle pectoralis major and pectoralis minor, and a third small muscle attached to the clavicle called subclavius. Then the clavipectoral fascia and the lower part of it called the suspensory ligament of axilla. All these form the anterior wall. Now we come to clavipectoral fascia. What is clavipectoral fascia? Clavipectoral fascia is the strong sheet of connective tissue just under the clavicular head of pectoralis major. We can see it starting from the under surface of the clavicle. It splits to enclose the subclavius muscle, then it passes down, and then again it splits to enclose the pectoralis minor muscle. Then it finally passes down. Now it is called as the suspensory ligament of axilla. It joins with the axillary fascia. This is called as the clavipectoral fascia. It extends medially up to the two intercostal spaces, and laterally it extends up to coracoid process and coracoclavicular ligament. We have to understand what are the structures piercing the clavipectoral fascia and passing inwards or passing outwards. Structures passing inwards are the lymphatics from the infraclavicular lymph nodes and the cephalic vein. If you look at the diagram, this blue colored structure, this is the cephalic vein. It can be seen going up in the axilla, reaching the area of the clavipectoral fascia and piercing it and passing inwards. Then structures piercing outwards are the thoracoacromial artery, which is a branch of the axillary artery, and the lateral pectoral nerve. Again, if we look at the picture, we can see the yellow colored structure coming out, that is the lateral pectoral nerve, and the red colored structure coming out, that is the thoracoacromial artery. Now we come to the posterior wall. What is the posterior wall? It is formed by muscles. So the first muscle is subscapularis, then we have the teres major, and we have the tendon of latissimus dorsi and the proximal part of the muscle, long head of triceps. The medial wall of axilla is formed by the upper 4 to 5 ribs, the intercostal spaces between them, the muscles in these intercostal spaces. Then the muscle serratus anterior and its digitations which are attached to the upper 4 to 5 spaces, the long thoracic nerve, and a nerve called as the intercostobrachial nerve. Now this intercostobrachial nerve is the lateral cutaneous branch of the second intercostal nerve. It pierces this wall medially and then passes laterally. Now we come to the lateral wall. To understand the lateral wall, we need to understand this diagram. This is a horizontal section. This is medial aspect showing the rib. That is anterior aspect showing pectoralis major muscle. This is lateral showing the bone humerus, and this is posterior showing scapula. So now once we have oriented ourselves to this diagram, what is the lateral wall? The lateral wall is formed by this groove called the bicipital groove or the intertubercular sulcus in the bone humerus, and inside it is the tendon of the long head of biceps. Then we have the short head of biceps and coracobrachialis. So together all these 4 structures, they form the lateral wall of axilla. Now coming to contents. What are the contents? So the same diagram showing you the contents. Now the contents are vessels, nerves, lymph nodes and other structures. So what are the vessels? we have the axillary artery and its branches, we have the axillary vein and its tributaries. As you can see, axillary vein is medial and axillary artery is lateral. Then we have the nerves that are the brachial plexus cords and the branches, and the nerve long thoracic nerve and intercostobrachial nerve. Now, these green structures, they are the lymph nodes, they are the axillary lymph nodes with their connections. So, besides these three important structures, we also have axillary fat, areolar tissue and axillary tail of breast. Now, we come to the second part of the lecture, that is axillary artery. So, what is axillary artery? Axillary artery is a continuation of the subclavian artery. It is a continuation of the third part of subclavian artery. It begins at the lateral border of the first rib, and this is the axillary artery, and it is called the axillary artery till it reaches the lower border of teres major. Thereafter, it is called as brachial artery. So, this from the outer border of first rib till the lower border of teres major, that is axillary artery. What is the course of it? So, it begins at the outer border of the first rib, it enters the axilla. This dotted line is representing the axilla, this triangle. So, it enters the axilla and passes from its apex to the base. As it is passing, it is more closer to the medial wall initially, and later it is more closer to the lateral wall. It is accompanied by the axillary vein which lies medial to it, and surrounding it are the cords of brachial plexus. The axillary artery and the cords of brachial plexus are enclosed within a sheath called as the axillary sheath. This sheath is derived from the prevertebral fascia. Now, we come to the parts of axillary artery. The axillary artery is divided into three parts, part 1, part 2 and part 3. It is divided by the muscle pectoralis minor. The first part is the part of the artery before the muscle. The second part is the part of the artery under the pectoralis minor, and the third part is the part of the artery after the pectoralis minor up to the lower border of teres major. So, we will talk about each part separately. So, first part, where does it start from? It starts from the outer border of the first rib. Where does it end? It ends at the upper border of pectoralis minor. What are its relations? So, relations of the first part: anterior, posterior, medial and lateral. So, in this diagram, this is the axillary artery. So, anterior relations, what are the anterior relations? Skin, superficial fascia, platysma, supraclavicular nerves, deep fascia and the muscle pectoralis major. Then what are the posterior relations? The first and the second rib, the intercostal space and the intercostal muscles, then the serratus anterior muscle. Anterior to that is the medial cord and long thoracic nerve. Now, we come to medial relations. Medially is the axillary vein. Now, we come to lateral relations. Laterally, we have the lateral cord and the posterior cord. Both cords are lying lateral to the axillary artery in the first part. Now, we come to the second part. In this diagram, this is the first rib, this is the pectoralis minor, this is teres major, and the pink structure is the artery, the axillary artery. So, now we are talking about the second part, that is behind the pectoralis minor. Again, first we will talk about relations. So, the anterior relations, the posterior relations, the medial relations and the lateral relations. So, the anterior relations are skin, superficial fascia, deep fascia and the muscle pectoralis major and pectoralis minor. Then we come to posterior relations. Posteriorly, we have the muscle subscapularis and the posterior cord of brachial plexus. Medially, we have got first medial most is the axillary vein, and then we have the medial cord, and anterior to the medial cord we have the medial pectoral nerve. Now, lateral relations. Laterally, we have the lateral cord of brachial plexus and coracobrachialis muscle. Now, we come to third part. As you remember, third part is the part which is lying after the pectoralis minor. This is the pectoralis minor, and we are talking of the part after the pectoralis minor up to the lower border of teres major, third part of axillary artery. So, what are the relations? Now, it is a long length of third part. So, it is discussed as relations in the upper part and relations in the lower part, and you can see the diagram, it has been drawn twice. So, we have axillary artery in the upper part and axillary artery in the lower part. So, the anterior relations of the first part or the upper part. The anterior relations in the upper part are skin, superficial fascia, pectoralis major. Then posterior relations are subscapularis and the radial nerve. The medial relations are the axillary vein, and medial to the axillary vein we have the medial cutaneous nerve of arm. Lateral to the axillary vein, first we have ulnar nerve a little posterior, and in front of the ulnar nerve we have the medial cutaneous nerve of forearm. Now, coming to the lateral relations, we have the median nerve and we have the axillary nerve, and further laterally we have the muscle coracobrachialis. Now, coming to the relations of the lower part. These are the anterior relations, these are the posterior relations, this is the medial relation and this is the lateral relation. The anterior relations are skin and superficial fascia. The posterior relations are the subscapularis muscle and the tendon of latissimus dorsi muscle, and lying in front of that is the radial nerve. Medial relations are, medial most is the medial cutaneous nerve of arm, then axillary vein, then medial cutaneous nerve of forearm and ulnar nerve. Laterally, we have the median nerve and coracobrachialis. Some salient points: relation of axillary artery to axillary vein. So, coming back to the diagram, this is the axilla, this is the upper part of the axilla, and we can see structures passing into the axilla from the neck. Blue color is the axillary vein which lies medial to the axillary artery. The red color, this is the axillary artery. So, we have to remember that the axillary vein runs from base to apex of axilla. Then second thing, it is nearer to the anterior wall of the axilla and it always runs medial to axillary artery. The second salient point in the relations are the relations of the cords and branches of brachial plexus to the axillary artery. In the first part, the axillary artery is related to two cords of brachial plexus which are lying anterior to the first part. In the second part, the three cords are around the second part of the axillary artery according to their names, meaning the medial cord is lying medially, the posterior cord is lying posteriorly and the lateral cord is lying laterally. In the third part, what we find is the branches of the cords of brachial plexus. They are related around the third part of axillary artery. So, this is what we have to remember in the relations of first part, second part and third part of the axillary artery to brachial plexus, its cords and branches. Now, we come to branches of axillary artery. The branches of axillary artery are learned under the headings branches from first part, branches from second part and branches from third part. It's easy to remember. First part has one branch, second part has two branches, third part has three branches. So, let us name them now. Branches from the first part, single branch, superior thoracic artery. Branches from second part, first branch, thoracoacromial artery, second branch, lateral thoracic artery. Branches from third part, subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Now, we will talk of the branches separately. The superior thoracic artery is a small branch. It arises above the level of pectoralis minor and supplies the first and second intercostal space and the serratus anterior muscle in the upper part. The thoracoacromial artery is a larger branch. It pierces the clavipectoral fascia above pectoralis minor and divides into its four constituent branches: a clavicular branch, a pectoral branch, a deltoid branch and the acromial branch. The clavicular branch, it supplies the sternoclavicular joint and the subclavius muscle. The acromial branch passes up and out towards the acromion and anastomoses with the neighboring arteries. The deltoid branch, it accompanies the cephalic vein in the deltopectoral groove and supplies deltoid and pectoralis major. The pectoral branch supplies both the pectoral muscles, pectoralis major, pectoralis minor, and also supplies the breast tissue. The second part gives rise to the lateral thoracic artery, the second branch. This arises deep to the pectoralis minor and can be seen at the inferior border of the pectoralis minor. It supplies the pectoral muscles, the serratus anterior, the axillary lymph nodes and the breast tissue through lateral mammary branches. It anastomoses with the pectoral branch of thoracoacromial artery, the subscapular artery, the internal thoracic artery and intercostal arteries. This is an important branch because it gives this artery called the lateral mammary artery to the breast. Now, we come to the third part and its branches. The first branch is anterior circumflex humeral artery. This is a cross section showing the humerus in the center, and this brown colored structure is the deltoid muscle. This is lateral aspect, this is anterior aspect. So, we can see that starting from the axillary artery, this small branch passing anterior to the humerus running in front of the surgical neck of humerus, that is the anterior circumflex humeral artery. It anastomoses with the branch coming from behind called the posterior circumflex humeral artery, and it gives a branch called the ascending branch which ascends through the intertubercular groove and supplies the shoulder joint. The second branch, the posterior circumflex humeral artery. It is a larger branch. It winds around the posterior aspect of the surgical neck of humerus and it leaves the axilla through a space called as the quadrangular space. This is the scapula, this is the humerus. We are seeing the posterior aspect, we are seeing the muscle above, we have the teres minor, in the lower part we have the teres major, and this is the long head of triceps. Together they form this space called as the quadrangular space, and passing out from the quadrangular space we can see the branch of the axillary artery called as the posterior circumflex humeral artery, and along with it a nerve coming out called the axillary nerve. Then we come to the next branch, the subscapular artery. This is a very large branch. It runs along the posterior wall of the axilla. It gives out a branch called as the circumflex scapular artery, and the main artery continues down as thoracodorsal artery. It goes all the way down to the inferior angle of the scapula and supplies the latissimus dorsi muscle ends by anastomosing with other vessels. Now, the circumflex scapular artery is an important blood vessel. It passes between the subscapularis muscle, the teres major muscle, and all the time it is medial to the long head of triceps. In this location, it is in the area called as the triangular space. It winds around the lateral border of scapula and reaches this area called infraspinous fossa. Now we talk about the scapular anastomosis. What is anastomosis? It is a collateral anastomosis between the branches of the first part of subclavian artery and branches of third part of axillary artery. This ensures that the blood supply continues to the limb in case there is any eventuality involving the blood vessel. The sites of anastomosis are in the subscapular fossa, in the supraspinous fossa and infraspinous fossa, and over the acromion process. In the subscapular, supraspinous and infraspinous fossa, we have these branches. From the first part of the subclavian artery through the thyrocervical trunk, we have the branch called suprascapular artery and a branch called the transverse cervical artery, which gives the dorsal scapular branch. They anastomose in the area which is the supraspinous fossa, with a branch coming from the third part of axillary artery, the circumflex scapular artery, which is the branch as we have already studied of subscapular artery. The second anastomosis is over the acromial process. This anastomosis is between the acromial branches of the suprascapular artery and the acromial branches of thoracoacromial artery and posterior circumflex humeral artery. Now, we already know that the suprascapular artery, this one is a branch of thyrocervical trunk, and we also know that the posterior circumflex humeral artery is a branch of third part of axillary artery. So, between these three branches there is an anastomosis over the acromion process. This is called as the anastomosis over acromial process. Now we come to clinical anatomy. You can see in this picture there is a large reddish colored area with a point, this is the pus coming out here. This is called as a axillary abscess. If it is of lesser amount, then it is called as a boil or a furuncle. This happens due to infections of the hair follicle and sebaceous glands of the axilla. It is a very painful condition and requires medical and surgical treatment. In the axilla, we can also have enlargement of axillary lymph nodes, which can be due to infections or due to breast cancer. These enlargements are felt in the area of the axilla. Then we talk about the axillary artery. Clinically, we may be required to feel the axillary artery pulse. We feel it in the lateral wall of the axilla. We compress the axillary artery against the bone humerus in the lower and lateral wall of the axilla. We have a very interesting condition called as pulsatile scapula. In the case of an injury to the axillary artery distal to the origin of the thyrocervical trunk, or in the case the axillary artery has been tied or ligated, this scapular anastomosis opens up and provides an alternate route for the blood supply to the upper limb. In this condition, if we place our hand over the region of the scapula, we can feel a pulse over that region. That is why the word pulsatile scapula. With that, we come to the end of the topic. Thank you.